Welcome to Common Sense, a 1/2 hour interview show brought to you by Berkshire Brigades, your county Democratic organization. I'm your host, Sherman Guernsey. We're committed to supporting our Democratic candidates and progressive Democratic values. And in addition, bringing you programs that are educational in terms of the important issues of the day and the important issues that we as Democrats care a lot about. Certainly one of those general issues is public health, your health and that of your neighbors. So what I'm going to be doing today is interviewing two very key people in this county, in Berkshire County, and they're with an organization called AHEC. And I'm going to let them explain to you what AHEC is. I was waiting to say this. What the heck AHEC is. And with me today are the Executive Director, Tim Diehl, and along with Diehl and Lisa Fletcher-Udel. Welcome to the show.
Thank you.
We're glad to have you. This is an important part of what Berkshire Brigades and the Democrats are really working hard to do, which is to make sure that the public knows about some of the important issues that we care a lot about. And certainly public health and your work in the studies that you do and the work you do is crucial. So thank you for being on the program. Tim, why don't you start it off and let the public know, what is AHEC, where are you located, and what kinds of things do you do?
Okay. In 1971, through the Manpower Act, there was legislation on a federal level that created the possibility for organizations such as ours to exist. Okay. And in 1979, we were created, and we were the first AHEC in Massachusetts. And we were really created to address an issue that is still a problem today, which is how to get primary care doctors, particularly, into rural, underserved areas. And so that was the beginning of our existence.
Okay, good. Now, you didn't say it, so I'm going to have to. AHEC stands for Area Health Education Center. And that is, I think that's helpful for people to know and not use just the acronym. So then within that rubric, there are important initiatives that you're doing, and one of them we'll talk more about, I assure you, is the primary care issue and that kind of crisis for getting primary care doctors to and in these rural areas. But let me turn now to Lisa for just a minute. What kind of initiatives, Lisa, are you taking in other areas in terms of the public health, and what are you doing?
Well, we have a number of initiatives. We're really focused on prevention.
Okay.
When I say prevention, we want to prevent youth from accessing tobacco products, for one. That's one of our initiatives. It is a law in Massachusetts that retailers are not allowed to sell tobacco products to youth. So the way that we work is to do compliance checks with the retailers, making sure they're not selling to kids and educating them. So really about education. Another initiative is to bring together service providers and consumers who are HIV positive and look at gaps in services and barriers to healthcare. And that's been a very unique kind of initiative when you bring consumers with providers in the same room to talk about the issues. We've also in the past, not this year, but in the past been working very diligently on the issue of teen pregnancy prevention. It's a very serious issue in this area and a serious public health issue.
Okay, let's start, if you will, in terms of looking at let's start with the last one you mentioned. I know that for years teen pregnancy has been a major concern. Tell me a little bit more, if you can. I should have told you to prepare about this, but some of the statistics or something, can you give us a sense of the problem?
I can't give you an exact statistic because I don't know it off the top of my head. But to tell you that when we do have statistics, we look at teen births, not teen pregnancy, because we don't know how many young people intentionally or unintentionally terminate their pregnancies.
Okay.
So we don't really know abortion rates for young people.
Right.
And nationally, statistics are kept the same way. They're per 1,000 resident women ages 15 to 19. And many people say, why don't you have statistics for young people under age 15? Right. That's because there are so few, thankfully, that are under age 15. Also, when we look at numbers, the majority of the youth that are pregnant are 18 and 19-year-olds. So it's not really young people, and many of them have finished high school. Pittsfield has about the 7th or 8th highest rate in Massachusetts of major cities, which means it's a significant problem.
Right.
And there's many reasons for teen pregnancy. I used to be one of those people who thought access to birth control is so easy these days. Why are young
why
people?
not? And what's going on? So what is going on? What are some of the reasons?
There's a lot of risk factors for young people. One of the reasons why teen pregnancy is such an issue is it's very connected to poverty and the socioeconomic status in a community.
Right.
When we look at communities that have high teen birth rates, it's in poor communities,
right.
unfortunately.
Yeah.
People have a hard time believing this about Pittsfield, but that's an issue.
Right.
It's really, I always want to do a workshop on teen pregnancy is not about sex. It's how you get pregnant, but it's really not what it's about. It's about lack of hope for the future. Right. Kids who are not connected to school, who don't do well academically, who come from...
Or not in activities, like sports and stuff, I assume.
Some of those, yes. Who have families who have multiple issues going on. These are low-income families. There might be violence and substance abuse going on in the family. They're just kids who are not connected. At least the young women are not connected. Young men is a whole sort of different story. We have in our society a double standard. Boys will be boys. It's sort of a rite of passage to become sexually active.
Yeah, right.
And it doesn't show on a boy, which is a whole...
Right, of course. Yeah, it's a whole big issue.
Yeah.
Huge issue. And are those rates, again, I'm not trying to push you on the definite statistics, but are the rates increasing? Is there a trend here, do you know, one way or the other?
They've stayed relative... they've gone up and down, but relatively level.
Okay.
We've had some impact over the years. One of the issues about preventing teen pregnancy is that one of the most successful programs that's been researched to really work with kids can cost $4,000 to $6,000 per year per child. It's a very expensive intervention.
It sure is.
So in the past, when we've been doing the work, the little bit of money we've had impacts the kids we've worked with, but certainly not every young person.
So tell us what AHEC is doing. What kind of programs or studies are you doing, particularly to address this issue?
Well, what we've done in the past, as I said, we don't have the money currently, but what we've done in the past is look at having research-based programs offered to young people. Teen pregnancy is one of the newer issues to be worked on in public health. For instance, substance abuse prevention has many years of research on a national level. Teen pregnancy doesn't have many years of research. So there are not as many proven programs that we know work with kids. But there are some. So when I came on board 6 years ago, we really made an initiative to use research-based programs and implement those in the community with young people. Really good sex and HIV education programs, which is a controversial issue on a national level. We have a federal government who wants to promote abstinence only and not give kids the tools they need to be educated and informed about their sexual decisions. So we actually have implemented some programs that provide good education for kids.
Good. Good. All right. Well, glad to hear about that. Tim, turning back to you for just a second, tell us about one of your other initiatives, whether it's in the, let's keep tobacco out of the hands of, young kids, or what else might you be working on more specifically?
Well, maybe a little different part of our programming is we actually convene a HIV/AIDS Service Coordination Collaborative, is what it's called, and actually Lisa is the convener of that effort. And we do that by bringing together providers and consumers and other interested and concerned people in the community who look at what kind of barriers there may be to services, are there duplications, those kinds of issues. And recently, actually, one thing that came out of the work of this collaborative was a resource booklet for people with HIV/AIDS. And so that's an effort to really bring the community together to really look at this issue. And while Berkshire County may not have huge numbers of people who are infected with HIV, the fact that we're in a more rural county sometimes presents more of a challenge for those
that
would get the services. So it's an important part of our services.
Let me go back for a couple of basics here. Where is your office located?
We just moved recently.